How to get rid of lower back pain. Low back pain is a universal experience. Almost everyone has it at some point. In India presently 1 out of every 6 individuals are having a history of low back pain. The lower back, which starts below the ribcage, is called as lumbar region. Pain in this region can be intense and is one of the top causes of missed work. Fortunately, low back pain often gets better on its own. When it doesn't, it needs effective treatment. There are many reasons that can cause low back pain, but most of those can be classified in lifestyle or medical conditions. Lifestyle causes back problems. 1. Nature of job. If your job involves lifting, pulling, or anything that twists the spine, it may contribute to lower back pain, putting undue stress on muscles and ligaments. 2. Your bag. Although you may carry a backpack or a briefcase, it is the lower back that supports the upper body, including any additional weight you carry. So any overstuffed bag can strain the lower back if your core muscles are weak, especially if you carry it day after day. 3. Your workout. Overdoing exercises in the gym is one of the most common causes of overextended muscles, leading to low back pain. You are especially vulnerable if you tend to be inactive during the week and then spend hours at the gym over the weekend. 4. Your posture at work. Don't slouch. Try using chairs that improve posture, or consider using devices that set off an alarm when you go into slouch mode. Improper posture due to slouching or straining at a desk may cause back pain and other muscle aches. Using ergonomics to modify a workstation can help reduce pain due to poor posture. If you tend to spend more than 4 to 5 hours sitting, you are most probable to have lower back pain. There are enough literature and studies which prove that sitting is the new smoking, as each hour of sitting reduces your life expectancy by 22 minutes. If a person does any lifting for their job, they should squat and use their legs, not their back, for support. So if you think your posture is the culprit for back pain, get it examined and corrected by a physiotherapist. Medical causes for back problems. 1. Osteoarthritis. This condition results from wear and tear of the spinal discs and facet joints. It causes pain and inflammation to a variable degree. It is associated with aging and slowly progressive. It is also referred to as spondylosis. 2. Spondylolisthesis. This condition occurs when one vertebra slips over the adjacent one more than it should. This happens as we age. The pain can be caused because of the instability or compression of the nerves. 3. Prolapsed intervertebral disc. The spinal vertebrae are cushioned by jelly-like discs that are prone to wear and tear from aging or injuries. A weakened disc may rupture or bulge, putting pressure on spinal nerves. This is called as herniated disc and can cause intense pain. 4. Sacroiliac joint dysfunction. The sacroiliac joint connects the sacrum to each side of the pelvis. This is a strong joint that primarily absorbs shock and tension between the upper body and the lower body. The sacroiliac joint can be painful if it becomes inflamed or if there is too little or too much motion of the joint. How to ease lower back pain? This is one of the frequent questions that people with spinal issues seek an answer for. Spinal pain can hamper day-to-day activities of an individual, thus it becomes imperative to address this issue and treat this in the beginning stages. Lower back pain has many different solutions which range from simple exercises to correct posture to medical intervention. The intensity of the treatments is dependent upon the severity of the problem. There is no one-size-fits solution or the best way to get rid of back pain. It is mostly caused due to daily individual habits. The treatments are also prescribed on the case-to-case basis. Some of the common treatments to relieve lower back pain are as follows. 1. Physical therapy. If back pain has left you inactive for a long time, a rehabilitation program can help you strengthen your muscles and get back to your daily activities. A physiotherapist can guide you through the rehabilitation program that will help you be fitter without straining your back. 2. Massage therapy. Massage can promote circulation, ease stress, relax muscles, and boost endorphins, the pain relievers naturally produced by the body. Some massage therapists can work in your home. If lying on a padded table sounds too painful, ask about using a massage chair instead. Research has shown that massage does more than just feel good. Many people find massage actually helps reduce their back pain. Massage may relieve chronic low back pain when done therapeutically, especially when combined with exercises and stretching. 3. Spinal manipulations. Chiropractors and osteopathic doctors use spinal manipulation to treat low back pain by applying pressure with their hands to bones and surrounding tissues. This treatment may not be appropriate for everyone. Although so many lower back pain treatments are available, 99% of low back pain is due to mechanical reasons such as lifestyle problems mentioned above and improve only with regular exercises, taking sufficient breaks during work, maintaining proper posture at work and following the ergonomics of work and workstation. If you suffer from lower back pain or back pain in general and want to learn how to get rid of it, then listen, let me tell you a quick story about one of my friends. Her name is Joyce. Joyce was in her 40s, but the arthritis in her back was so severe, she could hardly even walk. Just 10 minutes on her feet was torture. The worst part was, she had 2 young children but she was in such pain, it was difficult to play with them, or look after them properly. She felt like she was missing out on their entire childhood. Joyce saw physical therapists, massage therapists, chiropractors, and eventually she found herself in doctors' offices. The doctors all had the same answer for Joyce: surgery. The reason the doctors were suggesting surgery was because of her herniated disc. It was starting to slide, and if this continued, there was a high chance the disc would cut through her spinal cord, leaving her permanently paralyzed from the waist down. Joyce was devastated. She knew exactly how invasive the surgery was and wanted to avoid it at all costs. Now, listen. Your back probably isn't as bad as Joyce's was. But over time, things are only going to get worse. Your disc may soon begin to slide towards your spinal nerve also. So don't be surprised if one day, you bend down to pick something up, hear a crunch, and all of a sudden you can't breathe because the pain is so bad. That's how sudden these things can happen, so don't be surprised if this happens to you. However, Joyce's story shows that no matter how bad your situation is, there is always hope. I'm happy to say Joyce's story has a happy ending. Joyce learned the targeted spinal release method and she began using it daily. Within 3 weeks, she could easily walk for 30 minutes with zero pain. And just a few weeks after that, Joyce was completely pain-free. It was a remarkable transformation. Going from the verge of needing surgery and facing the prospect of being paralyzed from the waist down, to being pain-free in just a few weeks. All without steroid injections, endless chiropractic sessions, expensive doctor bills, and most importantly of all, this is the power of targeted spinal release method. If you are interested in learning more about this method, simply click on the link below under this video in the description and check out the method that made Joyce back pain-free in 30 days. If you're ready to take back control and get pain-free for the first time in months or even years, then you know what to do. Click the link below and start your back pain-free life now.